Good morning to everyone. Today we are going to uh, study or discuss upon the disease which is cystic fibrosis. Now let me share my screen with you so that you can better understand what I am uh, about to discuss or share with you all. Okay. Uh, I hope this is visible to everyone. Cystic fibrosis. Now, cystic fibrosis is a widespread problem which is related to the lungs. So, it is a respiratory disorder uh, and it is a genetic manifestation of uh, our disease. So, now let's discuss what it is. Now, cystic fibrosis is wherein all our chloride channels are not working properly. How do they not work properly is the chloride channel is responsible for making or giving this balance between how much of chlorine we have and how much of sodium we have in and out the cell. So inside the cell and outside the cell, both these are supposed to be in a balance, and that helps the cell to uh, you know, uh, perform its function, which is more related to cell to cell signaling or synapses, or it is also related to regulation of the various cell processes that take place. Now, if the chlorine channel is not functioning, that means the chlorine ions are not being let inside as much as is required. So chlorine is more outside. So that in turn leads to more amount of this salt concentration in circulation. So a person with default or defective chlorine channel perspires sweat which contains more amount of this chlorine. And another side effect is that the consistency of the mucus being produced wherever mucus is there. So we have two places where we have mucus. One is the respiratory system, the other one is the digestive system. So the respiratory system, uh, whatever mucus is generated, it is more stickier, it is more thick in constituency, and because of that, that mucus is not able to come out uh, of the lung, so you cannot basically put it out of your system. So that mucus then percolates in the lung and it causes a lot of problem to the person because it decreases breathing efficiency. It gives a lot of space for now microbes to make it a bed for them and grow on. Otherwise, cough or mucus functions to take or embed the microbe and it is thrown out of the body. So that is the defense mechanism. But when that mucus is so thick and heavy that it is not going to be thrown out, it will become a place where the microbe thrives. So you have double infection in the lung. So difficulty in breathing, thereby the wheezing problem, that is, you make sounds when you're breathing, persistent cough that does not go, repetitive lung infections, inflamed nasal passage of puffy, stuffy nose, and recurrent sinus. So all these are repercussions of not having a good or a effective chloride ion channel. Now, what are the next effects that will happen because of cystic fibrosis? So it will lead to poor weight gain and growth, obviously, because you're not able to give oxygen everywhere around. Then there are intestinal blockages for the newborns. There is severe constipation because again, the mucus that intestine produces, it helps in movement of the digested food or roughage towards the rectum, which will not happen. Then causes. So this is a mutation in a specific gene which we call as cystic fibrosis transmembrane conductance regulator gene. And this regulates this gene byproduct is a protein which is a channel protein. Then the next thing that we will see is risk which is associated with cystic fibrosis. So risk is that it is, once you have this defective gene, it is going to be there in your next generation. So it is a familial disorder. What are the complications? So we have damaged airways, we have a lot of chronic long time infections, we have small growth in the nose, which we call as nasal polyp, which is uh, soft and swollen, but it is kind of, if you touch it or try to poke on it, it is painful. Then we have sim since times when a person, because is it's consistently that person is coughing for a long time, blood comes up in the cough as well. So that is called as hemoptysis. So hemoptysis is a symptom. Pneumothorax meaning uh, wherein air leaks into the space between the lungs and the chest diaphragm. So the lung collapses. So pneumothorax is a condition that people with cystic fibrosis are prone to. Then there are more chances of respiratory failure because of overload on the lungs. Then we come to digestive system complications. So we have a lot of deficiencies seen in these people because absorption, uptake of nutrients is minimalistic or less than optimal because of the mucus generated in the intestinal system again, which is not doing its function, rather it is blocking the cells at the intestinal lining from taking up the nutrients. Then diabetes, liver disease, intestinal obstruction, eh, these are the other complications. It can also affect the respiratory reproductive system of uh, people. So both males and females can get affected with it. Other complications is osteoporosis, dehydration, and mental health problems. Now, how do we screen out for cystic fibrosis is first and the foremost thing is sweat test, which is the first thing I told you. Sweat is where there will be more amount of chlorine present. So this is a clear indication. Uh, so we can see over here 60% or 60 millimole per liter of chlorine or more is positive cystic fibrosis. Somewhere lesser than that, but more than 30 is you need further testing and you need further, uh, you know, time bound investigation. Less than 30 is normal condition. Then next things that we can do for screening out is of cystic fibrosis is first of all, if there is a sibling with cystic fibrosis, there is a newborn whom we are going to check for cystic fibrosis, or there are any clinical symptoms like the sweat problem, the lung complications, or nutritional deficiency or any such thing, then we go for checking the CFTR gene variants. So we will directly check the CFTR gene region of the chromosome. Then next thing is uh, all the CFTR gene uh, deficiencies or mutations are different. So which kind of CFTR variation is there that we have to search for. Then once we get that, what are the things that we're supposed to do? So we also have immunoreactive trypsinogen test for newborns. So this test is wherein uh, trypsinogen is quite high in cystic fibrosis patients. It is seen that. So we directly check for this protein. If it is very high, then that is an underlying but not confirmatory test, an underlying prognosis. Then we go for sweat test, then we go for sputum. We check for the uh, mucus and see if it has any microbe for, multiple infections to take place. We check in chest X-ray, we will find a lot of blockages. You can see that in CT scan. Also, we will find the kind of damage that all the alveoli in the lungs will have, and pulmonary function test. Or pulmonary function test is how much of your lung is working properly. Then medication that can be given is antibiotics can be given to combat the lung infection. Mucus filling medications, they are by far the most required for cystic fibrosis patients. So it will cause the mucus to uh, reduce inconsistency, thereby helping in breathing activities. And we have uh, non-steroidal anti-inflammatory drugs, which will also help in or it is like a breathing aid that are there. Bronchodilators are again like the ones which reduce or dilute the mucus. Then we have the CFTR modulators. Now for this, we need to know which gene variation is present. Accordingly, the treatment can be given. Thank you so much.